Good day, ladies and gentlemen. I am Pavel Krastev, DDS, and I join you from New Hyde Park, New York today. Welcome to the audience, to our friends and colleagues across the world. And before we get into our show and our topic today, today is clearly a special day. It's Mother's Day. And on behalf of Global Summits, myself and Dr. Kiana Shah, and of course, my new friend, Dr. Eric Block, we'd like to wish all mothers a very happy and very healthy Mother's Day. Some mommies are with us. Some, unfortunately, may not be with us. But mothers are the cornerstone of development. And we love you, moms out there. And just enjoy your special day. And we love you here. All right, moms, so enjoy. So today, ladies and gentlemen, we're going to be discussing quite an interesting topic that I feel, and I'm sure many of you will agree, touches all of us in one way or another, and that's stress and burnout. And my new and dear friend now, Dr. Eric Black, that I met in the green room prior to the show, he's dedicated quite a bit of his life and his story into this arena. He's an implantologist from Acton, Massachusetts, and he's a general practitioner, just like myself, who, from what I understand, does a substantial amount of implantology work and cosmetic dentistry as well. So it's really it's going to be a wonderful show. And as I said, stress, there are so many forms of stress. Stress can be from pollution. Stress can be physical, can be emotional, and certainly can happen from work. Now, the way I was thinking about this last night, about the show, and stress can often be managed, and there's certain stresses that we can eliminate, and there are other stresses in our lives that perhaps we put ourselves in that we cannot eliminate. So I kind of see the stress as being fixed or variable, and the variable stress, the way I see it, can be modified. So by changing some of our behaviors. For example, if you're constantly late to work and you're constantly running and stressing that you're going to miss the train, well, that's something that perhaps you can control by waking up a little bit earlier. There are other stresses, like, for example, you buy a big house that's maybe a little bit bigger than you should have bought. That's going to give you stress that becomes fixed and you really can't control unless you sell the house. So this is a very important, I believe, arena in all professions. And because when you burn out and when stress gets to you, that can lead to anxiety disorders, personal disorders, family trouble. You could lose your practice in many cases, your life even. So I think it's a fantastic topic that we've picked today. And let me introduce Dr. Eric Block. Dr. Eric, welcome to the program. Before we roll, before I ask you a couple of questions, let me have the pleasure of reading your bio to the audience, and then I'll introduce you formally. All right, guys, give me 1 second. Let me just open it up, and then we'll get to, okay, here we go. All right. So Dr. Eric Block is on a mission to help dental professionals everywhere overcome burnout and anxiety. He is a full-time practicing general and implant dentist in Acton, Massachusetts. He's the founder of the digital marketplace, dealsfordentists.com, host of the Deals for Dentists podcast, host of Live with Blocky on I Love Dentistry Facebook Live, and helps dentists to become more efficient, productive, and less stressed. He's certified by the American Association of Dental Boards for continuing education, and is a speaker, key opinion leader, husband, and the father of 2 kids. Well, we shared that in common, my brother. Anyway, in 2021, he authored his first book titled The Stress-Free Dentist, Overcome Burnout and Start Loving Dentistry Again, in quotes, and hosted the Get Stress-Free Dentistry Summit in Hollywood Beach, Florida. He is the communications chairperson and member of the Health and Wellness Task Force for the Massachusetts Dental Society. So that's a very admirable bio there, my brother. And
Thank you.
tell us a little bit now. I'm curious to know, before we get into the core of the topic, how did you get here? What motivated you to become a dentist? What further in your career triggered this interest? to dedicate so much of your time and effort into educating colleagues like myself and others how to get rid of this burnout, to get rid of the stress, reduce it. Wild topic.
Yeah, well, first of all, thanks so much for having me. It's a pleasure to be here, and I think what you're doing is awesome, and I love this platform. So to me, this is an honor to be here. And I did not take the traditional route of becoming a dentist, and I go a little bit more into this in my presentation. But my dad is a retired dentist, and I actually went to college down in New Orleans at Tulane, and I was going to be a business major and go to the business school. That was my plan. I wanted nothing to do with dentistry. And I sat there in microeconomics and statistics and macroeconomics with like 500 kids in the class. And I said, you know what, this isn't for me. So I needed to figure out to do something. And I chose psychology as a major because I had to choose something. And I was interested in maybe becoming a physical therapist, a physician, maybe dentistry. And then one night I was at a bar in which many college students tend to do. And I maybe had a bit too many, and I just missed my mouth, and I hit my number 9 central incisor, and it broke in half on a beer bottle. And I walked around that night with half a tooth. And of course I had no pain because I was intoxicated. But the next day I went to a local dentist in Metairie, Louisiana. And I just really liked the experience of how they patched me up and took care of me. And I walked in all embarrassed, and I left with my smile back. So I said, you know what? Maybe dentistry is something I could do. So I started taking all the prereq classes. At the time at Tulane, I'm not sure about now, but there was no pre-dental or pre-medical. So I stuck with psychology, and I did all the prereq classes on the side, organic chemistry, general chemistry. And I took a year off after college, and I taught tennis, and I took the DATs and studied physics, and then ended up hanging around my dad's office. And then I applied and got into Nova Southeastern down in Fort Lauderdale, and ended up after 4 years of dental school getting into an implant program at BU at Boston University. And that's kind of what brought me back to Boston. So that's my story.
Well, I see that we have a little bit in common because my wife and our nanny, they've been trying to kill me all these years. And, the last time they attempted to get rid of me, they did it with a lemon seed, and I broke one of my premolars, a virgin tooth, mind you. And I suffered and a lot of pain and suffering, you know what I mean? But so I'm still missing one. My veneers were inserted yesterday, and everyone yesterday, I was so happy. I shared it with my friends on Facebook.
Looking good.
But I'm still missing the beauty over here. So I totally hear you, my brother. Sometimes, especially when we're younger, we do silly things, and sometimes we get away with them, and sometimes we break a tooth or two sometimes. But I think dentistry is such a, the more, the older I become, the more I realize how much I love it. And the more I realize every day I want to learn something new. Whether it's a little trick with an endophile, and I'm constantly learning on YouTube and watching some of the masters of certain areas of dentistry and how they do things. And I got to tell you, it's an exciting profession. And I certainly hope that my daughters, or at least if I'm lucky, one of them will follow in my footsteps, because it's exploding with technology, and computers and certain materials are obviously making our profession that much better. And I just can't imagine where we're going to be in 20 years. So, all right, Dr. Eric, let's get into your presentation, and we look forward to it. And at the end, we'll maybe have a little discussion, take some questions, perhaps. So I turn over the floor to you, my friend.
Okay, I'm going to share my screen, and at the end, I'm an open book. So if anyone has any questions, fire away. Let me share my screen here. And let me know if you can see that.
Yeah.
Everyone can see that?
It's looking good.
Okay.
Go ahead.
Again, I just wanted to thank, everyone for whoever's listening, live or the recording. It's such a pleasure to be here, and such an honor. And I'm looking forward to sharing my story. Before I get into my story, I wanted to give a little bit of a background about myself, which I did share a little bit, and in that great intro. But as we mentioned, I'm a full-time practicing dentist in Massachusetts, and my dad's a dentist, like I mentioned, so dentistry runs in my family. But I didn't expect to be a dentist, and sometimes that's life just has these ways of happening, and here I am, a practicing dentist, about 20 years in, and a lot of dentists say that, and I hear it all the time, and they say that dentistry has been the greatest thing that's ever happened to them, and they love every minute of it. And to tell you the truth, that wasn't the way it was for me. In fact, about 10 years ago, or earlier on in my career, I actually really regretted my place in dentistry, and I was so stressed and nervous all the time, and I was so afraid of getting sued that I even thought about leaving the profession and becoming a lawyer so I could be the one doing the suing. I wanted to flip the script, and be on the other side of it. And a lot of it, was just me. It was in my head. I'm an introvert, and the nature of the profession was just exhausting, for me to have to go from room to room to room and always feel like you're on. Sometimes dentists, you always feel like you have to almost like act in front of the patient like you're in this great mood, and no one wants the tired, sad dentist working on them. So to me, it was that constantly being on and the constant social aspect of the profession that really wore me down. And I also felt like I had to be perfect for everyone, and I was saying yes to everyone else. And there was a point where I couldn't wait until I retired. I couldn't wait until the weekend so I could recover from the week. I couldn't wait until 5 o'clock so I could go home. And there was even a point where I couldn't wait until lunch so I could go home and decompress. And, I said to myself, this is no way to live, and this is no way to practice for the next 30 years. And I looked at myself in the mirror and I said, you got to do something here. Life is too short to dread going into work every day. And as I mentioned earlier on, I was a psychology major in college, and I knew that I always wanted to go to therapy, and get involved with psychotherapy, and I just never did it. Well, I finally did it, and I finally picked up the phone and called a local therapist, and I started going to therapy, and I really just figured out, what made me tick and why I was the way I was, and I ended up writing a book about it, and I wanted to share my story. And it's called The Stress-Free Dentist: Overcome Burnout and Start Loving Dentistry Again. And felt like I had a story to share. And I felt like if there was one or two or three or four dentists that this story could resonate with and help with, then to me, that was a success. And one of my major philosophies in helping other dentists is it's so important for you to be you. Some of the things I'm going to show you are some of the workflows and techniques that have helped me, but that's me. And everyone is different, and everyone's situation is different. Everyone's background is different. Everyone's practice is different. So it's very important for you to be you. You find out what works for you. I'm going to show you some of the game changer products and techniques and workflows that have worked for me and have made me become a lot more efficient, less stressed, and productive. But everybody's different out there. I think it's extremely important to have a plan. Now, having a plan has helped me so much, where I used to just go into procedures and I would just wing it. I didn't have a plan. I would just pick up a burr and just start drilling. And a lot of times this created stress. Now I go into every procedure with every patient, and I've created a plan in my head. And sometimes that takes a minute or 30 seconds. Other times with implants, it takes longer because there's a lot more involved. but I will go from step to step to step, or burr to burr, or material to material, kind of like a football team marching down the field, executing play after play. And I try not to go backwards. I go from step to step, and it's a game plan. And I have this game plan in my head, and I try to repeat it over and over and over again. So it's almost like my brain has gone on autopilot. And I'm going to share with you some of those workflows and some of the game changer tips and techniques that have really helped me in my day-to-day dental practice. And again, out there, to any of the dentists listening, take what you can and what you will, but you be you. I think the most important thing is to find your game plans, to find your workflows, to find your game changers. I'm going to show you some of mine, and they may help you, but go out there and find yours. So one of the biggest game changers for me is having an anesthesia plan, getting patients numb. This is so important. And I used to not have a plan. I would just try to get them numb and wing it. And then I would take a burr to a tooth and they would jump, and the patient was stressed and I was stressed. So now I have a very strategic plan on getting patients numb. And this really influences every other step in the game plan, in the workflow. If a patient isn't comfortable and adequately numb, they're not going to have a good experience, and neither are you. So one of the biggest game changers for me is the endo ice test. Before I take a burr to any tooth, I will soak a cotton swab and I will place endo ice on it, and I'll soak it until it's very cold, just like you learned in dental school. And it's the endo ice test. And if the patient feels the cold, they're not numb. No passy the icy, no drilly. I want to make sure they are totally numb before I take a burr to that tooth. So I go through a whole workflow of local anesthesia until I make sure that that patient is adequately numb and they don't feel the cold with the endo ice test. If they may feel pressure, but if they feel cold, then they're not numb. So I have a whole workflow that I go through, and typically I'll give an upper, any upper teeth or lower teeth that are non-molars. I'll infiltrate buccally with Septicane. Lower teeth, I'll give mandibular blocks, just like you learned in school, and then I'll check with the endo ice. And if they're still not numb, sometimes I'll inject with the PDL right around the tooth with the PDL injection, but with my regular syringe with some Septicane. I'll wait a few minutes, and if they're still feeling the endo ice, then I'll give the Tuttle Numb Now technique, which was developed by Dr. Greg Tuttle and has been a total game changer for me. And there's no patient now that I feel like I can't get numb. There used to be some cases where I would have to dismiss the patient because I couldn't get them numb and they weren't comfortable. And that's a very stressful process. Patients don't want to feel pain, and I don't want them to feel pain. So Dr. Tuttle has created a great technique that's worth watching. And I wish I had learned earlier on in my career. Another game changer for me is I use an isolation device. An isolation device I can't believe I ever worked without one. It's made so much less stress for me emotionally and physically. I used to struggle with shoulder pain and trapezius pain. I had a shoulder surgery about 10 years ago, and my left shoulder is my retracting arm. So my left shoulder by the end of the day would be toast. I would be really struggling by the end of the day. But now with an isolation device, it's created a lot less pain because I don't have to retract a strong tongue or the lips or cheek. I also could not tolerate even that tiny little light on my loops. So this gives an extra amount of illumination and so much less pain. And pain is pain. If you're in physical pain, to any dentists out there, try to find your game changers and workflows that help decrease pain, because if someone's in physical pain, they're not a happy camper. It's hard to be in a good mood when you're having pain. So for me, an isolation device reduced so much physical pain. Another game changer for me was I will do back-to-back class 2 fillings now. I'll do two bands, one wedge, one ring, and back-to-back class 2 fillings. Class 2 fillings used to be the most, I would say, time consuming and tedious process for me. And I would dread doing them, especially a quadrant of them. But now with my back-to-back technique, they're actually quite efficient and go by very fast. And this is a game plan. This is something that I've come up with that works for me. And up in the upper right-hand corner, you can see the cotton swab, and I'm testing the endo ice on the tooth. And you can see, your classic back-to-back class 2 lesions there. And on the lower right here, another quick tip is I always take a photo, an intro image of the decay. And at the end of the procedure, I'll show the patient and I'll show them the area of cavity. And typically they'll say, "Oh, that's gross," or "Wow, thank you so much for getting to this," or "I'm so glad we did this." There's never that situation where a patient says, "This filling never should have been done." When they see that photo of the decay and I show it to them, they own it and they say, "Thank you so much for getting this done." So I have a workflow, and again, this works for me, but you be you find your workflows. But I do 2 bands, 1 wedge, 1 ring, and I do consistently and predictably back-to-back class 2s, and I'm getting predictable proximal contacts and proximal contours. And again, here's the burrs I use, and I go step by step with each burr, and each burr has a purpose, and I typically do not go backwards. I go through my workflow, and I have a plan in my head. Here's another example of back-to-back class 2s. Again, 2 bands, 1 ring, 1 wedge, and again, my workflow of burrs. And to me, this has been such a game changer for class 2 composites, which is one of the most common procedures as a general dentist that I do all day. I'm going to show you my crown technique. And again, here's the burrs I use. And I go through them step by step by step. And crowns used to take me way too long. And I would pick up a chamfer burr and just start drilling. And I didn't really have a plan. And they were taking me way too long. And I started to create this workflow that has worked for me. And I'm going to show you what that is. So here's a number 14 with a large composite filling, and patient had some fracture lines and they were having pain with chewing. So we decided to do a crown. And my workflow is I'll take the round burr that you see here on the lower right, and I'll make my buccal margin and lingual margin, and then I'll just sweep up. I'll sweep up on the buccal and lingual, and now I've created my margin on the buccal and lingual, and I've also created my buccal and lingual depth cuts. So my buccal and lingual are done, and that took me about a minute. I move on to the next burr, which is typically a 245 burr, and I make my interproximal cuts here and here, and then I make my depth cuts in the occlusal. Then I go on to the next burr, which is the football diamond, and I'll reduce the occlusal based off the depth cuts. And then I'll move on to the thin chamfer here and go interproximal. And I break the marginal floor, so I see gum on both sides, on the mesial and distal. And then I pack cord. And I do this pretty much every time, unless there's super gingival margins. But packing cord, I used to always pack cord 360 degrees around the tooth because that's how I learned. But now I typically just pack cord where I need it. Sometimes that's 1 cord, 2 cords, 3 cords, 4 cords, whatever you need to get a good margin and isolate the margin so you can get good hemostasis and good exposure of the margin. And again, I'm no, expert at crowns. And if I showed these pictures, to 10 dentists, you get 20 different opinions on my crown preps. But the point is that this workflow works for me, and my crowns are taking me about 15 minutes, and they're predictable and they're not stressful at all like they used to be. So I will finish with a large chamfer and just go around and finish up my prep. Sometimes I have a little diamond here in case the patient can't open very wide. And again, you can see my isolation device here, which I pretty much use for most procedures now. Now I started with digital scanning just after the quarantine, and I'd thought about doing it for years. And I finally made the move because I had the time during the quarantine, and we went digital. I have a Trio scanner, and I will never go back to analog impressions. This is a game changer for me, is going digital. It has made me look forward to doing crowns. I now enjoy doing crowns more than I used to. And I believe it's made me a better dentist. And my staff enjoys it. They enjoy scanning, and patients are totally wowed by it. There's no more bloody, goopy impressions that I have to mail out or analog impressions. But I will never go back to analog impressions now that I've gone digital. So these are game changers that have really made me enjoy dentistry more. And here's an example of the tooth that I prepped, and it's made me a better dentist because I'll scan the tooth, and I know I'm not done yet, but I'll scan the tooth and then I'll blow it up about 10 times the size, and then I'll check my prep. And if I need to re-prep in a certain area, I'll just trim the margin on the scan, and I'll go back and re-prep and rescan. So I have seen my prep blown up, and if I don't like where something looks or a margin isn't clear, I'll go back and re-prep. It's just made crowns so much more predictable and efficient. Also with the occlusal reduction, total game changer, especially with second molars. I used to, look with the mirror and guess and hope I had 1.5 millimeters of reduction. But now you can see with a digital scanner exactly how much reduction you have. And if I don't have enough, I'll go back and prep more and then rescan. And there's some really cool things you can do with the digital scanner. But I think ultimately it's just made me better at doing crowns. You can see if you have undercuts, you can trace your margin if needed. The shade is pretty accurate. And to tell you the truth, my assistants now, they do most of the scanning. They do the preliminary scans, the initial bite scan, and then they trim out the tooth, and then I'll prep it and I'll do the final scan. But most of it's already done. So another, I think, often overlooked treatment is the crown insertion, delivery date of the crown. I did not have a plan before, and I would just wing it. I'd try on the crown, I'd check the floss, and I would cement it on, and sometimes the bite felt high, and crowns, inserting the crown, were way more stressful than they should have been. It's because I didn't have a plan. And now I have a pretty specific protocol that I go through. And along with digital scanning, my crown insert appointments are taking me about 10 or 15 minutes with minimal adjustments. But I'll typically take the temporary crown off. I'll try the real crown on, and I'll check the bite. I'll check the floss, and I make sure that the assistant is holding the crown down when I check the floss so it doesn't pop off. I'll take an x-ray of the tooth. And it's so important to have just a nice light snap with the floss. If it's too tight and you can't get the floss down, then the crown probably isn't seated. And I'll check again with the bite paper because sometimes that pushes the crown up a little more. And I'll check the floss again. And I don't cement the crown on until I'm happy with the flossing contacts. When I am finally happy with the flossing contacts, then I'll check the occlusion. Once everything is all set, I'll treat the intaglio surface of the crown, and then I'll push the crown on. This, of course, this crown is way too light, but that's what the patient wanted, and they actually loved the color of the crown, even though it's like 5 shades too white, but that's what they wanted. And now I'll make sure that I push the crown on with my thumb, and I kind of rock around buccal lingual and kind of make a little circle with my thumb as I'm pushing up. And you should see excess cement squirt out from the buccal and lingual. If you don't see that, the crown is probably not seated. From there, I'll clean up the cement, and then I'll have the patient bite on cotton. you should still see a little more cement squeeze out. From there, I'll floss and I'll wipe up any extra cement. And after it's fully set, I'll have the patient sit up, and I'll make sure they check their bite again while they're sitting up before I take my gloves off, because we've all been there. You know, the patient sits up and you've taken your gloves off, and then they say the bite feels off and you have to get your gloves back on. But with this technique, typically it's dead on. And after they sit up and rinse out, they check their bite, and it feels good. But the important thing is that I go into my crown insertions with a plan. I think one of the biggest game changers of them all, which has made me less stressed in dentistry, is guided implantology. I've been doing implants for 20 years. And at the first half of my career, I essentially freehanded them and treatment planned them off of 2D technology. I would just hope that there was enough bone. I'd use a PA or a pan and open my flap, and I'd pray there was enough bone. I'd also pray that my initial pilot hole was in the right angulation and position. There was a lot of, I would say, guesswork and a lot more stress than when I switched over to guided implantology and guided surgery based off of 3D planning. So here's my scan. This is a number 30 implant. So I'll do a digital scan of the patient's mouth, which is my STL file. This is the file that I will plan the future tooth on and the surgical guide on. And then I will take a CBCT of the patient, which I actually have now in my office, which has removed so many barriers. I used to refer patients out for CT scans, whether it was to the mobile van, CT scan center, or to a colleague. And a lot of times they just wouldn't go through with it. So now having a CT scan right in my office has removed barriers, and patients are moving forward with treatment quicker. It also allows me to plan virtually. I'll do this right in front of the patient, where I'll place the implant virtually. I'll even place a virtual tooth, and I'll show them, and they are wowed, and they can see the level of technology that I'm using. It also is a way for me to see whether I'm comfortable doing the case. A lot of times earlier on in my career, I got involved with cases that I shouldn't have, whether they were too complicated and out of my comfort zone. Now I can see exactly right then and there in front of the patient if this is a case I feel comfortable working on. And if not, I'll refer to my colleagues. Most of the time they are, but there's some cases that are really thin with bone, or they're just difficult patients to work on, and I'll refer them out. And I'm so glad I did. But I'll do this right in front of the patient, and then I'll plan my 3D printed guide. And I essentially, most of the time, I have fully guided kits, but I'll make like a large pilot hole essentially with my 3D printed guide. And I'll prep right through that cylinder. This is printed. And I've created my initial pilot hole, which is about, I would say, about 90% of the work. And I'll put the guide on the teeth. I'll make sure it's positioned well with windows. Again, you can see here I'm using my isolation device. Isolation device I even use with implants. There's so many little parts and pieces that can get dropped in the patient's mouth that the isolation device keeps the tongue away, keeps the lips away, but it also is that like safety blanket in case you drop something. But here's my pilot hole. I think I'm 90% done there. And I will check with an indicator pin typically. I think it's such a great habit to take an x-ray with the indicator pin to make sure that you're all lined up, because sometimes you think you're lined up and you take an x-ray and you're not, and you have to go back and re-angulate. So I always take an indicator pin x-ray with my pilot hole. And then from there, I'll just widen my osteotomy according to the manufacturer's recommendations. And I'll place my implant, which is typically subcrestal. And I will typically place a healing cap on if I have good primary stability. And you can see here, I keep it very simple. I have a little titanium dish here that is magnetic and it holds my burrs. I keep it very simple with my drills and my instruments that I use. Now, here's a case that I did about 10 to 15 years ago, not guided. And I'm showing this to you because this can happen. This implant I did was placed freehand. It was obviously too distal and too distally angulated. And the patient came in and their abutment and crown came loose. And I decided to rescan the patient. And I didn't take the implant out because it's still an implant that I can restore. Sure, I wish I could go back in time and re-angulate this, but it is what it is, and I made the best of it. And I decided to make a new screw retained crown for the patient. And instead of just putting the previous one back on, and here's my scan body. And I scanned it and I sent it to the lab. And most of the technology now has a great workflow where it takes you step by step. You scan the scan body, you scan the emergence profile, and then it's off to the lab. And my typical workflow is a screw retained full zirconia crown. I've really gotten away with without using cement as much as possible. I always use a brand new final screw for all of my cases. I don't reuse the lab screw that the lab sent because I don't know how many times that's been used, and I want a brand new screw. And here the case is, again, not ideal, too distal. It's angulated. I wish I could go back and redo it, but it is what it is. Here's the screw hole. And I fill it up with Teflon. I used to use cotton, but it smelled, so I use Teflon now. And I'll pack that in and leave about 2 to 3 millimeters. And then I'll use a flowable composite to fill in the access hole. And then I always show the patient, and I do this with any prosthetics. I'll make sure I show the patient in the mirror. I'll show them sometimes on the model, but before they leave, I show them their prosthetics in the mirror to make sure they're happy before they leave. And, for dentists out there, a lot of times we're in our own little bubble and we're isolated, especially solo practitioners. One of the important takeaways from this lecture is that I think it's so important to reach out to your peers and engage with mentors, peers, consultants, coaches, but also to get out of the hamster wheel of just doing the same old thing over and over and over again, whether it's fillings and crowns and removable. I found that doing new treatment modalities and new techniques and new technology has been such a help and in my career, and it makes you look forward to going into work. Doing new treatment modalities, like for example, sleep and airway, I'm starting to get involved with more. And here's my brother-in-law, he has sleep apnea. And guess who else has sleep apnea? This guy. I took a home sleep test and I actually woke up 15 times. Actually, I woke up 10 times every hour. And I have mild sleep apnea. And you know what? I'm 46 years old. I have 2 kids and I want to be around for them for a long time. And I was snoring. I wasn't feeling rejuvenated. So I said, you know what? I'm going to be my own first patient. And I took the sleep test, which is looked at by a board certified sleep specialist. And I made my own sleep device. And it actually at one point at night, I had actually sat up and I gasped for air. And I had no idea I was doing this. I knew that I snored and my wife was annoyed that I was snoring. But I had no idea that I actually was sitting up and gasping for air. And this is not good. We need oxygen and we need our sleep. So I decided to make my own sleep device. And actually, here's that number 9 crown that I was talking about. That's what started it all right here, where I broke my front tooth in college. And these are my teeth here. I scanned my teeth. I did a protrusive bite on myself and I made my own sleep device. And here's the NG2 by the Gelb Institute. And it protrudes my lower jaw. So it opens up the airway and my snoring has greatly decreased. And I'm going to start providing this for my patients. So this is a new treatment modality that I'm looking forward to adding to my practice for the next 20 years. So it's something exciting. It's something different. And I really think that's a great way to avoid burnout. 3D printing, like I mentioned earlier, I 3D print my own guides. This is my old 3D printer. Let's see if this works here. This is an FDM printer, which is like almost like a hot glue gun. This is an old Cell Robox printer that I had for about 8 years, and it did me well. And I 3D printed my own guides. But now I just got my new printer, and I'm going to start printing models and night guards and dentures and temporary crowns and veneers. And this is something that I'm looking forward to. It's something I'm excited about. It's new technology. It's new treatment. And it really can re-energize yourself, your staff, something new that your staff can really enjoy. It's great for culture, adding something new like this. And your patients are going to sense this. Your patients are going to sense your enjoyment and your excitement. And if you show them this technology, they will be wowed, and they will tell their friends and family about you. Another treatment, which I did not learn anything about in dental school, is clear aligners. I'm starting to add clear aligners to my office. And my wife is going to be my first patient. And clear aligners is just booming. There is so much treatment out there to be done. And I'm going to be starting with just very simple cases, just mild lower crowding, your typical case where an adult didn't wear the retainer and their teeth shifted, very simple minor cases. And it's just a matter of bringing it up with patients and asking, hey, have you ever thought about, fixing your lower crowding or fixing your spaces? But here's my wife's teeth, and she's going to be my first case. And these are her buttons. And I'm just super excited about adding this treatment modality to my practice. And these are all things that you can do and really avoid burnout, because like I mentioned earlier, doing the same old thing over and over and over again, that is a recipe for burnout. Before I wrap things up, I would mention earlier about physical pain. I feel like sitting is the new smoking. I stand now, like it's the 1920s. I actually moved all of my chairs out of the operatory, and I stand while I'm working. I also stand. This is my back office. This is my stand-up desk here. This goes up and down. And my pain has decreased significantly. I don't get the pain in my trapezius like I used to. I can stand for long periods of time now. And I have this bar that I hang from in my back office. And while I'm standing, I actually am doing like yoga poses, and my staff, they make fun of me, but they'll be having a serious conversation with me, and I'll be in like tree pose. And it's not even weird anymore because they're so used to it. But I'm constantly moving, and I'm constantly standing and stretching. And I used to feel like I would have to wait until the end of the day to go and exercise or stretch. But now I'm constantly doing it throughout the day. And, I have minor aches and pains here and minor tweaks, but I don't have the back and neck pain like I used to. One final thing that I want to leave off with is, which I'm going to be starting to do in my office, is Blocky's Choice. So I want to end the week with a patient or a treatment that I want to finish up with. So like Friday afternoon, I'm going to start creating these blocks called Blocky's Choice. So these are patients that I'm going to put in to finish off the week, whether it's a certain treatment that I want to do or a patient that I work on, to kind of, end up on a good note for the week. Okay. So this is a picture of a book from my 7-year-old son's book. And this one really just hit home. Is a story about an egg that was putting too much pressure on himself, and he was cracking up. And I love this picture. He was getting an IV of yolk at his egg doctor's office. But dentistry is a grind. It is a marathon, not a sprint. And I think it is so important for us to not try to be perfect, not try to be putting too much pressure on ourselves. Because guess who has made mistakes? Every other dentist ever in the history of dentistry has made mistakes and has had a less than perfect outcome, has had a unpleasant patient experience, has gotten a bad review. It's going to happen. And if it does happen, don't beat yourself up. Just move on, and you're going to have a bad day. You're going to have a bad patient experience. You're going to have a bad week. the important thing is to realize this is totally normal and to move on and just learn from your mistakes, and to reach out to your peers. Help yourself before you can help others. Learn what makes you tick. And I'm here if you need me. And you can reach me at info@thestressfreedentist.com, or any of my Facebook book groups. I'll also be live in Nashville. And it was such a pleasure to be here. And I wanted to thank you for having me. And please, anyone, don't hesitate to reach out for any questions.
Dr. Eric, this was one of the finest and very useful presentations that I've seen in a very, very long time. I mean, we always have great partners and great speakers, but this presentation touched me on a personal level in so many ways, because I realized that I practice much in the same manner that you practice. And what I totally admire, the courage that you have to come out and share with the world your personal story that was so truthful, and it showed the trials and tribulations that you went through in your life, and that's just so wonderful. And I love when people are not afraid to come forward and share their goods, the bads, and the uglies, experiences, cases. None of us are perfect. I think we all strive for perfection, but perfection is almost unachievable when you treat a human body that's essentially getting older from the minute they're born. We do our best, and sometimes I think we beat ourselves over the head by demanding too much from ourselves, and by wanting more than really is feasible. And it's difficult, but it's still a great profession that I love. So there's so many things you touched on. I mean, I would love to stay in touch with you on a personal level and share more experiences, because I think there's a lot that I still want to learn from you. And I certainly, if you don't mind, I'm asking you personally, please put a link of where we can purchase your book in the comment section after the show, because I certainly will purchase one today. Having said that, again, you touched on so many things. I jotted up a couple of things. Anesthesia. I mean, now that I'm thinking about it, of course, when you don't have proper anesthesia, that gives you stress. It gives the patient stress. It gives the staff stress. It kind of can ruin the day at times. And if anyone doesn't tell you they miss a mandibular block, they're lying to you. I miss it all the time personally. But anyhow, wonderful, wonderful presentation. And there's one thing that I want to mention regarding technology and X-rays and this. I tried digital X-rays about, and I'm kind of going to make up the number because I can't be specific, but about 17, 18, 19 years ago. And I used it for probably 2 years, and it drove me crazy because a full mount series will take me forever, because I like to use the rings and properly position everything. But yeah, as much as I found it wonderful in the quality of images compared to analog, it just drove me nuts to the point that I put it in the closet. I actually left that practice that I had with two other lovely gentlemen. And then I went back to analog in my current practice. And then approximately a month ago, I said, my wife, actually, she forced me. She goes, look, we got to start doing digital. You know, we do a lot of implants. We do not a lot, but a substantial amount of endo. She goes, we can't wait 5-10 minutes for x-rays. And she's absolutely right. So now I reintroduced digital into my life, and I got to tell you, I'm loving it. Additionally, I have the Trios scanner that we just came in. We have them training tomorrow, and I'm looking forward to using that as well. But here's why I bring this up. A few days ago, a very unpleasant situation occurred on Facebook, where a colleague attacked me for no reason, making fun of me and mocking me why I am so late with digital and this and that, and started poking fun. And here's what I want to tell colleagues in general. We are in the same profession. We should strive, be closer to each other, and not poke fun of each other. It's not nice. One thing escalated to another the other day, and it became very unpleasant. I'm sure the gentleman who started this trouble with me personally is a fine fellow, and unfortunately now I lost a friend, I guess. But what I want to make a point is there's many doctors across the world who don't have the financial means and abilities to perhaps stay at the most current equipment in the marketplace. And we can't go around making fun of anybody, guys. It's just not nice. It's uncalled for. It's unprofessional. And you know what? It's at the end of the day, it's very sad when colleagues trash one another. And very, very sadly, furthermore, there's a couple of trolls out there. They like to troll people and just make stupid comments and make false accusations. And that's disgraceful. And you really guys should get a life and get the hyenas that you surround yourselves with and just go back into your home, because it's not nice. We like good people. We like people who like to share knowledge, experiences, and just enjoy dentistry and treat our patients better. Having said all that, Dr. Eric, let's see if we have any questions from the audience. I'll check here in the comments. But man, I love the presentation. I want to know more about you, and I certainly want to read that book. So get it out.
Oh, thanks so much.
If you want to put any closing comments, feel free while I check if we have any questions from the audience.
Yeah, no, I think you said some really powerful things there, and I think together we can do more. Nobody's perfect. Everyone's going to have a bad day, and I used to get so nervous if a patient, would leave a bad review, or a patient didn't like me, or they didn't schedule an appointment with me. I used to say, "What happened to that patient? Did they schedule?" And you know what? If they didn't schedule, or they left a bad review, it's going to happen. I do my best, and I try to educate patients and give them my treatment plan. And if they agree, great. If not, then I did my best, and maybe they're better off somewhere else. But it's going to happen. You're going to get a bad review. You're going to have an unpleasant situation. You're going to have a less than perfect outcome. And that's totally fine, because like I said, guess who else this has happened to? Every other dentist ever in the history of dentistry has had a less than perfect outcome. So, learn from the mistakes. One of my teachers at BU said, smart people learn from their mistakes. Smarter people learn from other people's mistakes. Of course, I didn't listen to that, and I had to learn from my own mistakes. But learn from mentors, colleagues, and try to find out what works for you and best in your hands.
Regarding reviews, that's a discussion I would love to raise in one of the future HEX Commission meetings that we'll be having throughout in the future. But I think it's we have to, as doctors, address the fact that so many reviews are, they're genuine reviews from people that have been treated, but so many are false reviews that people get their friends and cousins and mothers and fathers. And it even gets bad to the point that it has come to my attention that certain colleagues ask their staff to leave reviews for other doctors just to put them down. I mean, I think, criminal, is disgusting. It's so unprofessional that people like that do this. And I certainly have met a few who I know do this kind of activities. This is ridiculous. It's shameful. And these people should really be banned from being in the profession. It's pathetic. But reviews are certainly, I think, something that has to be monitored in a level where people really have to either sign their reviews that they place for other colleagues, where there's a track record, so that they can be more fruitful and honest in what people write very often. But so what? I think in my opinion, in my practice is 110% referral based. Okay, I don't do any advertising. I have a very, very small practice. And getting back to what you said earlier in the beginning of the presentation, everyone practices the way they want to practice. Some guys like to have 10 chairs and 6 offices. Others want to work with 2 chairs or half a chair or on a dental stool. That's their business. Respect what they do. As long as they do it right and they try their best, hey, then what more can we ask? So, Dr. Eric, listen, great presentation. I thank you so much. Once again, to all the moms out there, we wish you a wonderful day. Happy Mother's Day. Stay blessed, and we love you. And I say goodbye from New Hyde Park, New York.
Pleasure. Thank you.
Likewise.